Did you know some of the medications you or your loved ones take daily could silently triple the risk of a devastating stroke? For seniors over 60, this hidden danger can be fatal if ignored. You might not even realize it, because these drugs are prescribed to protect health, not harm it. Every minute counts when it comes to stroke risk, and being unaware of these medication dangers could mean the difference between full health and permanent disability. Today on Golden Aging Health, we reveal the 5 most common drugs that increase stroke risk in older adults and what you need to know to protect yourself. If you're over 60 or care for someone who is, this could be the most crucial information you hear this year. Don't let these medications quietly put your brain at risk. I've spoken with dozens of seniors who thought their medication routine was under control until a stroke changed everything. Before we begin, hit like and subscribe to Golden Aging Health, your trusted source for life-saving, science-backed health tips for seniors. Here's an important reminder. Medications can affect each person differently, especially as we get older. This video is for informational purposes only and does not replace professional medical advice. Always consult your doctor before stopping, starting, or changing any medications. Let's start with the first drug on our list that many seniors take without realizing its hidden dangers. Drug number 1. Blood thinners. Are you managing them safely to protect your brain? Blood thinners like warfarin and aspirin are commonly prescribed, but are you sure you're using them safely enough to avoid serious risks like stroke? These medications are commonly prescribed to help prevent strokes by thinning the blood and reducing clots. While they can be life-saving, they also come with important risks, especially for seniors over 60. Research from the American Heart Association highlights that patients on blood thinners need regular blood tests and close monitoring to balance clot prevention with bleeding risk. Missing doses, mixing medications, or even certain foods can disrupt this balance and increase stroke danger. Consider Mark, a 72-year-old retired teacher. Mark took his blood thinner exactly as prescribed for his atrial fibrillation, but he ignored frequent nosebleeds and unexplained bruises, thinking they were harmless. One day, he suddenly experienced a severe headache and weakness, the result of a bleeding stroke. His doctor explained that subtle signs of over-anticoagulation should never be ignored. Safe management of blood thinners can save your life, but it requires vigilance and communication with your healthcare team. Have you ever had any struggles or questions about taking blood thinners? Share your experience in the comments. Your story might really help someone else stay safe and informed. Next, we'll discuss the second drug on our list that's commonly prescribed but can quietly raise stroke risk if not carefully used. Drug number 2. Non-steroidal anti-inflammatory drugs, NSAIDs, common but risky for seniors. Are you in the habit of reaching for over-the-counter pain relievers like ibuprofen or naproxen whenever aches and pains strike? NSAIDs are popular and easily accessible, often seen as harmless helpers for headaches, arthritis, or muscle soreness. But for seniors over 60, these medications can carry hidden dangers that you might not be aware of, especially when it comes to increasing your risk of stroke. Studies from the American Heart Association indicate that prolonged use of NSAIDs may negatively impact cardiovascular health. The real concern is that these medications can raise your blood pressure, a major trigger for strokes in older adults. Elevated blood pressure increases the workload on the heart, damages blood vessels, and raises the likelihood of blood clots forming, which can block blood flow to the brain. Mary, 72, took ibuprofen daily for chronic joint pain. She thought it was the safest way to keep her pain under control without bothering her doctor. Unfortunately, after experiencing a minor stroke scare, her doctor explained the risks associated with prolonged NSAID use and urged her to explore safer pain management alternatives. Now, Mary regularly monitors her blood pressure, and uses other methods to manage her pain, reducing her risk of future cardiovascular problems. If NSAIDs are part of your routine, it's essential to have an open conversation with your healthcare provider. Ask about other pain relief options that might be safer for your heart and brain health, especially if you have conditions like hypertension, diabetes, or previous heart disease. Regularly checking your blood pressure is also a critical step in staying safe while managing pain. Self-medicating can sometimes do more harm than good, so avoid increasing your dose or frequency without medical advice. Remember, just because a drug is available over the counter doesn't mean it's without risks, particularly as our bodies change with age. Coming up next, we'll discuss another commonly prescribed medication that seniors should be cautious about, especially when it comes to stroke risk. Stay tuned to learn more about protecting your brain health. Drug number 3. Certain antidepressants, a hidden stroke risk for seniors. Have you or someone you know been taking antidepressants for mood or anxiety? While these medications can greatly improve quality of life, certain types have been associated with a higher risk of stroke, particularly in adults over 60. Some common antidepressants, such as SSRIs and TCAs, not only improve your mood, but they can also affect the way your blood clots and your blood pressure. These changes can slightly increase your risk of stroke, especially in people over 60. A study in the American Journal of Geriatrics found that people who take these drugs have about a 30% higher risk of stroke than people who don't. The level of risk depends on the drug, the dose, and your individual health status. Take Margaret, 68, who began SSRI treatment after retirement. She noticed some dizziness and mild blood pressure fluctuations, but didn't connect it to stroke risk until her doctor explained the connection. Together, they adjusted her medication and added lifestyle changes to lower her overall risk. If you're taking antidepressants, it's really important not to stop them on your own. Instead, talk openly with your doctor or nurse about any worries you have. They can help find safer ways to keep you feeling good while also protecting your heart and brain health. Also, if you found this video helpful, tap the like button and subscribe for more life-saving health insights. And don't keep this information to yourself. Share it with friends and family. One simple click could save a life before it's too late. And now, just as promised, let's move on to drug number 4. Another common medication that many seniors take without realizing it could be quietly raising their stroke risk. Drug number 4. Certain diabetes medications, could they be raising your stroke risk? A few months ago, I heard the story of Pan, a 75-year-old retired teacher from Atlanta who was managing his type 2 diabetes with medication and thought everything was under control. However, he began experiencing dizziness and occasional headaches that confused him. After some testing, his doctor discovered subtle signs of reduced blood flow to his brain. It turned out that some of the diabetes medications he was taking could be affecting his stroke risk. He was then switched to a safer alternative that was more appropriate for his age and health needs. From the story above, we can see that some common diabetes treatments, especially certain types of sulfonylureas, can cause blood sugar fluctuations, which puts extra stress on your cardiovascular system. These changes can increase blood pressure or increase the risk of blood clots, both of which are major causes of stroke. Research from trusted medical groups like the American Heart Association has also found that older adults who take these medications may have a slightly higher risk of stroke than those on other treatments. That's why it's so important to check in with your doctor regularly to make sure your medication is the safest option for keeping your blood sugar and your heart healthy. Next, we'll look at the 5th and final medication many seniors take daily but rarely realize its hidden risks. Drug number 5. Common blood pressure medications. Could they be harming your brain? What has your experience been with taking blood pressure pills daily to manage your numbers? While controlling hypertension is vital for stroke prevention, certain blood pressure medications may actually raise stroke risk in seniors over 60 if not carefully monitored. Certain medications, especially those that lower blood pressure too aggressively or cause sudden drops, can reduce blood flow to the brain. This can lead to dizziness, falls, and even silent strokes, which often go unnoticed until serious damage occurs. According to Harvard Health Publishing, overly aggressive blood pressure lowering in older adults can sometimes reduce cerebral perfusion, the blood flow to the brain, potentially increasing the risk of cognitive decline and stroke. This means that while managing hypertension is important, finding the right medication and dosage balance is critical for brain health in seniors. That's what nearly happened to Mary, 72, who faithfully took her prescribed meds, but began feeling lightheaded and unsteady. After discussing her symptoms with her doctor, her medication was adjusted to better balance her blood pressure without compromising brain circulation. Think managing blood pressure meds is straightforward. Even small adjustments can protect the brain. Share your experience in the comments and type SAFE below if you're committed to keeping your medication effective and your brain healthy. Now take a moment to review the 5 common medications that may quietly increase stroke risk in seniors over 60. Certain blood pressure drugs, over-the-counter NSAIDs like ibuprofen and naproxen, antidepressants, specific diabetes medications, and blood thinners when not managed carefully. These medicines might seem routine or harmless, but for your brain, they can silently raise the risk of stroke. Understanding these risks and having open conversations with your doctor can be the key to staying healthy and avoiding serious complications. Research from Harvard Medical School and other top health institutions shows that many seniors using these medications either underestimate their risks or overlook important warning signs until it's too late. Taking any of these medications or caring for someone who does means it's essential not to ignore any warning signs. Make sure you check in regularly with your healthcare provider and discuss ways to keep your brain protected and healthy. If this video helped you view stroke prevention differently, please hit the like button and subscribe to Golden Aging Health for more trusted advice designed especially for seniors. Share this video with friends and family. One simple share could save a life. For more in-depth information, explore our playlist, Stroke and Heart Attack, where we dive into medication safety, lifestyle changes, and brain-boosting habits. Watch it today before it's too late. Thank you for spending time with me. Take care, and I'll see you in the next video.